I'm Andrena Logue. I'm the principal analyst at Kable, and I'm a dedicated analyst in relation to frontline healthcare across the UK.
Okay.
I come along today really to just listen to some of the core themes that are resonating across the NHS, to hear some of the policy makers, and more importantly to hear some of the direct experiences that some of the CIOs and directors of IT at NHS trusts are experiencing.
Brilliant. It seems to be quite an interesting time for the NHS. Obviously we've got the sort of checkered history with the National Programme for IT, and we're sort of aiming for a paperless NHS by 2018. What are you sort of seeing as the sort of key opportunities and challenges for the NHS at the moment?
Yeah, well, I think we're really in a massively disruptive period. We've had the reconfiguration across primary care, but I think critically, as we go through this year and over the next few years, secondary care will have its own form of disruption, particularly acute care. And we've heard from one of the speakers today about protecting the brand and the reputation of his respective trust. And it's really, it's how, in many ways, how IT can be aligned into the clinical and the corporate sides of trusts in particular, as they grapple with KPIs like the digital, the paperless economy, integrated records, and more critically as they start to evolve and form relationships with other care providers, community, the voluntary sector, for example, and look at care pathways like end of life. So today's event for me is really interesting and important to sort of learn more about how frontline health providers respectively look at the digital platform and potentially cloud or as a service in terms of how they marry these two conceptually, because these are massive issues. And on one level, digital makes a lot of sense, but when you start to think about how you can integrate a cloud strategy, for many trusts at the minute, that's quite daunting. And I think IT suppliers in particular have a huge responsibility and opportunity to break through some of that siloed thinking, which has been the result of has been the legacy from the national programme, but more importantly to evidence how all of this next generation technology, which is already with us, can actually benefit the NHS directly and by default lead to some cost savings and obviously better healthcare.
And what are you seeing in terms of perhaps the trusts that have decided they want to move to the cloud? What are their challenges in getting there? How difficult is it to go from perhaps the sort of legacy systems to what they see as the future with the cloud?
I think the trusts that are doing it well are, in some cases, you still have to think of the opportunities as on a case-by-case basis where that trust has been. For example, if they have an internal culture of transformation, they're used to canvassing opinion and respecting opinion from all levels across the clinical front line. So they're used to having an internal self-critique, if you like, dialogue. The cloud for them or digital is clearly evidenced, but that's really been accelerated by support from the top, from the board. If the IT director or the CIO actually has a place around that table, they obviously, it's easy for them to evidence and to lobby for reasons why that supports the business case, not just in a clinical perspective, but in terms of meeting some of the financial targets, being able to benchmark themselves locally or regionally and ultimately nationally, so that they can start to show their own staff what they mean by best practice.
And the ones that have moved to the cloud, are they sort of seeing improvements in frontline service as a result, as well as cost savings and efficiencies?
I think, again, when we look at trusts, it is on a case-by-case basis, because not every context is relevant to sit in the cloud, and you have to see, you have to understand internally what the natural starting point in terms of migration towards the cloud would be for your respective trust, where you are in terms of your budget, what your IT skills are, what the gaps are, and as we've seen already at today's event, having a digital strategy is an additional element, if you like, of your overall IMT strategy. So you have to understand as an organisation where you are, how you're going to deliver services over the next 5 to 10 years, to what extent IT is already embedded in your system, in your day-to-day operations, what the gaps are and how you can plug that.
Okay.
So it's a sort of iterative thinking process rather than complete on-premise leap to the cloud.
That's interesting, because from my understanding, one of the problems with the national programme was that it was sort of this mandated standard that was meant to be applied to all, but obviously all these trusts and hospitals and everything's so different that
Yeah.
there was sort of a reluctance there to change to that standard system. Is that less of an issue now with what's happening at the moment?
I think it is. We're really in a very critical phase, I think, in terms of how trusts decide and the level of guidance that they're giving, and we're seeing a lot of, in my personal opinion, better support and hardcore guidance coming from the DH via NHS England, and obviously we have the HSCIC in place that's done a lot of great work. The technology is there. It's the context around which you can apply that within a healthcare setting that needs to be evidence, needs to be discussed. But there's a lot of great opportunity out there. There's a lot of there are examples, even exemplars if you like. I think on the clinical side, which in my opinion dictates the pace at which IT can be deployed, there are equally a lot of great opportunities coming through, and the whole concept of integrated care, however you define that locally, is with us, and there are lots of opportunities there, lots of areas clearly where IT can actually support and accelerate progress there.
Okay. We tend to see that there's a lot of sensitivity with NHS, obviously, in terms of data protection. I mean, for care.data, for example, barriers have been put up as a result of the concerns around privacy of the data, etc.
Yeah.
Is that still a block of cloud for the trust?
I think yes, and I think as you know has been the case previously on the enterprise side, internal resistance in the terms of people and processes needs to be broken through as well. So you do need an experienced IT director or an IT director who has access to support, who can actually build up the case for why the cloud or as a service is a relevant opportunity for them. But again, that comes through some of the transformational work that's been put in place, where you actually have a risk management policy maybe, where you can look at identifying gaps, where you have an IT director who's not afraid to just roll up their sleeves, go in and just basically see, you know, what have we actually got? Is it fit for purpose? Is it, you know, are we moving away from this awful cliched burning platform, keeping the lights on? What are we actually doing? Can we be a strategic tool for the trust? So there's a lot of work to do, but equally there are very good IT directors out there who are already in the midst of transforming.
And in terms of the UK as a whole, what sort of stage would you say we're at? And with the general election looming, how much of a disruptor could that be?
Well, and do you mean what stage are we at in relation to digital deployment?
Yes.
Or I think early. I think one of the great accelerants will be a lot of the, if the trusts do absorb a social media strategy as well, because I think back to the care data conundrum, if the public are encouraged, and by all senses they seem to be receptive to that, if they are encouraged to have an open dialogue with the NHS, and they can see that by criticising constructively it does lead to progress, that will, I think, on many levels shore up confidence about access to records and how that's used. There's still a lot of work in place, but I think digital is just beginning, and I think we also heard again this morning from Tim Kelsey, you know, let the thousand flowers bloom. I think a lot of the applications and the experiences around which digital and IT can support healthcare have yet to really evolve. We're just at the beginning by utilising IT that's already available in the enterprise sector. So it's all positive, I think, but it just has to be managed carefully.
Okay, that's interesting. And the last question I've got for you really is there anything you would like to see central government doing more to perhaps encourage adoption and get things moving?
I think basically provide lots of good local support, provide platforms whereby trusts can get together, where they're encouraged to collaborate. Healthcare models in other neighbouring UK regions like the UK and Northern Ireland, I appreciate they're smaller populations and there's a smaller number of healthcare providers, but they are actively encouraged to speak and meet regularly and share best practice, and I think that can really break down some of the perceptions that are out there through direct experience, maybe that IT isn't, you know, not where it needs to be yet in healthcare.
Okay, brilliant. Thanks very much, Andrena. Thank you.
You're welcome.